Hi everyone, welcome back to another Candace's Corner, where I where I interview people in the field or people with lived experience with developmental disability on and on important topics that might affect us. My name is Candace Cunningham. I am a person with lived experience in cerebral palsy and IDD. Um, I work at the University of Missouri, Kansas City Institute for Human Development, which we all use it. Um, so I work on a lot of projects, a lot of self-advocacy projects, which is one is the We Shared, which is the leadership project or speaker rule training, and under that training is Candace's Corner, which is a podcast series where I interview leaders from across the state talking about key issues that might affect the disability community. So for this session, I am interviewing Dr. Deven from StationMD, and we're going to talk about StationMD and how it will fit under self-determination and taking control of your life. Dr. Deven is the President and Chief Medical Officer of Station MD. Hi, Dr. Deven.
Hey Candace, thanks for having me today.
Yes, thank you for being here.
Of course.
Do you want to talk a little bit about yourself?
Yeah, sure. Candace, I'm a physician. I'm actually a board certified emergency physician and have been practicing emergency medicine for about 20 years or so. Over the last 10 years, I spent my career focused on individuals with intellectual and developmental disabilities after myself and two of my partners, physician partners, founded a company called StationMD. And StationMD is basically a telehealth company that provides support for individuals with intellectual and developmental disabilities 24 hours a day, 7 days a week. We're basically there as the backbone to help provide medical support for individuals with disabilities when they need it, wherever they are, whenever they have an issue that has to deal with their health. And they can't reach their primary doctors or their specialist doctors. So we're there as a bridge so that they don't have to rush to an emergency department or an urgent care center and continue doing the things that they need or love to do.
So, Dr. Deven, you, the purpose of Station MD is what you said is to bridge that gap from maybe not being able to go to your primary doctor, but still needing to get that care. Is that correct?
That's absolutely correct. That was the vision of Station MD when we first started, and that's what we continue to do. And we continue to support individuals with intellectual and developmental disabilities throughout 26 different states, and we support 40,000 individuals, 44,000 individuals with intellectual and developmental disabilities.
That's a lot. So, so, where did Station MD start? Did it start in Missouri or?
Oh, the concept of Station MD started in the brain, in my head. My head and my two partners' heads, because we were working in an emergency department, right? And in the emergency department, I would see individuals with intellectual and developmental disabilities come through the doors while I was caring for everybody in that emergency department. And many times these folks would come through the doors and have minor complaints. But those minor complaints were obviously important to the individual, but when you compare it to the strokes and the traumas and the heart attacks and all the things that were happening in the emergency department, they were triaged at a lower level. So what ended up happening was these folks ended up waiting for long periods of time. And when I got around to getting to see these individuals, I would learn very quickly that this was a relatively simple issue that could have been managed at home. And that happens with everybody, not just with people with intellectual and developmental disabilities. But the problem with this particular group of folks was that they were with either a caretaker or a family member that had to support them and bring them in. They maybe had some mobility issues. They had some folks had some sensory issues. And the emergency department is a very loud, busy, chaotic, smelly environment, and the people that were caring, like my staff that was caring for this person, was touching them, moving them, putting them in different positions, and it was very uncomfortable for these individuals, for multiple reasons, right? And my staff wasn't really trained as well in caring for individuals with intellectual and developmental disabilities, and in the end, the person just didn't get the best care, and they didn't get the best care because maybe they missed some of their chronic meds. So they were there for 6 to 8 hours. Unfortunately, this is how it is. You sit around in the ER for long periods of time, but maybe you're on a medicine for seizures, or maybe you're on a medication for constipation, and you don't get your medications at the time that you're supposed to get them. You miss them, and though I may take care of your problem 6, 7 hours later, you go home, and because you missed your med, you ended up having a seizure, or you ended up getting a bowel obstruction because you didn't get your constipation medications. And really, what ends up happening is then you end up coming back to the ER with a more serious problem. And this we saw happen over and over and over again. And we had to come up with a solution. Like, it just wasn't the right care that I felt I was providing for these individuals. So when we thought about it and I actually talked to one of the caregivers in the emergency department. It was actually a paid caregiver, a DSP, with an individual that had autism that lived in a small group home near the ER that I was working in. And I asked the caregiver, I said, why did you have to come to the hospital for something minor? It was a small little scratch on the arm. And the caregiver said, look, I'm responsible for this person's care. This person can't advocate for themselves. And I didn't know, I'm not trained, I'm not a trained medical professional, and I didn't know if this thing was a real serious problem or if it wasn't. So I had to bring him in. And I said, well, don't you have like a doesn't this person have a doctor or a nurse or somebody that can help support you to make that decision? And the caregiver told me something that was enlightening to me, because I always thought that, especially individuals with IDD that live in a group home, that there was this support system, that there was a doctor always available or a nurse always available. And she told me that's not true. She's like, no, we try to get a nurse on the phone, or we try to call the patient's private primary doctor, but if we don't get a response in a certain period of time, I got to do something. So the only recourse I had was to come to the ER. And so then I asked her another question. I said, what if you were able to pick up the phone and call me and ask me about this particular problem, and I gave you advice on what to do with the problem and felt that you could safely stay home if you did X, Y, and Z? Would that solve you having to come to the emergency department? And she said, if you can do that, please give me your phone number. I will call you probably once or twice a day with all the different people that I support. And she was like so relieved, if and I did. I gave her my phone number. I'm like, just call me. I can tell you. But then she said, I would need form signed. I would need a note. I need something documented because I'm responsible for this person's care. So that got the wheels turning. And that I was like, well, what if we were to start something where we could assess this person and then do it over video instead of telephone, so I could really get an idea and have access to their medical records so that I could really make a good educated decision and determination for this individual, and then electronically prescribe some medications, or if they needed them, or send over a requisition for a lab slip or an x-ray if they needed them. We could probably avoid a lot of unnecessary visits to the ER, free up that caregiver, and allow that individual to live as independently as they possibly could. Right? So that's why we started StationMD. Now, certainly there are some situations. Look, emergencies happen, and they happen to everybody, and they should go to the emergency department. And then we would say you need to come to the emergency department. But the vast majority of the time, things, many situations can be handled at home without having to disrupt the entire day.
Yeah.
So that's why we started StationMD.
And that's cool because you had that lived experience where you were in the hospital
Yeah.
and asked the caregiver or provider, and they, so you saw it firsthand. That's pretty cool.
Yes, we saw it firsthand day in and day out, and that's
Hmm.
really, and it was frustrating for me to see that because, I knew that we weren't providing the care that these people deserved, that
Hmm.
anybody deserved, and if there was a way that we could change that a little bit for the better, then that would be great. Yeah. So,
And
at that point, Candace,
mhm.
I'm sorry to
No,
interrupt, but
you're fine.
you
You're
had
fine.
asked me if we started in Missouri. We didn't start in Missouri. We actually, so I was working in an emergency department in New York, and so we started Station MD in New York, and we started it with a small, tiny, tiny little grant from New York State Medicaid to provide innovative services to populations at risk. And IDD qualified for a population at risk. And I thought that this was pretty innovative. So we sat down and wrote a proposal, and they gave us a few $1,000s to start this process up. And we started with one ICF and one, in New York they call it IRA, but which is a general group home. And we quickly saw within a month the adoption of this technology and the adoption of the utilization of the service. And 90% of the visits that we were able to resolve at home, that they did not have to go to the ER. And if they had to go to the ER, we called the ER doctors and nurses and told them, this person's coming, they've got this disability, this is what I'm worried about. So they were expecting this person and they could plan for everything that was going to happen. So that's how we saw the benefit immediately, and as a result, we're like, we got to do this, right? We have to expand this service and make sure more people get access to it.
Well, and I remember, um, I feel like Station MD came to Missouri around COVID.
Right before COVID, in 2019, we actually met with the Department of Mental Health and in Missouri, and the director of DD Services, and we pitched our service, and we said, look, this is what we got. We think we could really benefit your people, and they started us with a pilot with all 15,000 individuals that are on a waiver, Medicaid waiver service, and then slowly we got the word out. And then 6 months later, COVID hit.
Yeah, yeah, that was crazy.
It
Cause
was crazy.
I feel like I was might be in the middle of that pilot whenever it came, because I'm like Station MD. I know of that. Yeah, sorry.
Yes.
um,
Yes, that's exactly what happened because that's where, and then, the world changed, right? In COVID, everything changed. And at that point, like Zoom and FaceTime, that became like an everyday thing. And you were doing all these things with your doctors, so then now the adoption of telehealth really grew. And then we were able to see significant benefits to the IDD population because some of these in-person practices were closing. They weren't allowing people in. And for somebody who's got a complicated medical history, who traditionally sees doctors like maybe once a month or every 2 or 3 months, all the different problems going on, is a big deal. Like, how do you bridge that gap? And fortunately, we were there and we were able to help as many people as we could. So it was
that's
very
awesome.
rewarding, actually.
Everything happened for a reason. um,
That's right.
yeah. How does, and you kind of talked about this, but how does Station MD works with other healthcare providers and support systems to provide care?
Yeah, so we actually work. So, we talked about the Missouri Department of Mental Health. So we work within their system, right? So all the folks that they support, we work with them to get the word out that we're available for their folks to call us anytime they need us. And that allows us to be accessible to the individuals that are supported at the state level. Now, every individual we encourage and must have a primary care doctor and their specialist. We don't take the place of those folks. We are there as a bridge, as a stopgap. We're there as a support until you can reach that individual. And when you sign up for our services, we ask about who your primary care doctor is. We get their information, and then we send them information after our visit so that once our visit is completed, the communication is also delivered to the primary care doctors. Candace, we also connect with the Missouri Health Information Exchange. So basically, whenever we're done with our document is uploaded through the state's Health Information Exchange, HIE. So any physician, emergency department, hospital system that has access to that HIE can see what happened in our telehealth visit. And a lot of times we have some valuable information put into our visit so that other doctors can get that information when they see that individual. And Candice, I don't know if you've heard of HRST,
No.
Health Risk Assessment Tool. So that is actually a tool that all individuals in the state of Missouri get screened. All individuals with an intellectual and developmental disability get screened for, and this tool is done by their supports coordinator, and we have access to that tool, so we get to see what the individuals what their goals are in life, what they love to do, what they enjoy to do. Of course, we get their medical history, we get their medications, so we've integrated with that tool so that we have access to that at the time of the visit so that we can tailor the visit towards that individual so they feel a little bit more comfortable and we know a little bit more about them.
So you're very centered. You make sure that even though they're here, they're going to you guys for their health, something, but you want to make sure you know that little bit about them to connect with them and not make them worry. That's cool.
More at ease and more comfortable and more willing to like talk to you. Maybe they're a Cardinals fan and it's opening day, and then we could just say, "Hey, how the Cardinals doing?" Something like that. So it just kind of makes people feel a little bit more. It's not as rigid. Now, listen, you're in your own home or in your environment that you're comfortable in, so that already makes that individual much more calm and much more willing to share information. And now, if we know a little bit about them, it gives the confidence that they're like, "Oh, this doctor kind of knows a little bit about me." And then we can get some good information and they feel comfortable and we can make a difference.
I like that. I like that. So So you how does StationMD adapt its telehealth model to accommodate communication barriers or cognitive challenges for individuals with a disability?
Yeah, that's a really good question. And disability, when you say the word disability, it's a very broad term, right? So, like you said, it could be a cognitive issue, it could be a physical issue, it could be a visual issue, it could be a hearing issue. So, it's hard to accommodate for every possible disability that's out there. We try to be as inclusive as possible. And we also know that along with the individual is usually some other person, like a caregiver, a parent, a family member, a guardian that can help this individual connect if they need the help to connect. Um, in addition to that, we also, in our visits, for those that prefer to read the visits or have a hard time hearing, we have closed captioning that appears on the bottom. So you can, instead of, if you have a hard time hearing what I'm saying, you can read what I'm saying. We also have access to sign language interpreters. So at the visit, on our visit, we could press a button and then a sign language interpreter comes on the screen and they can help us interpret American Sign Language if that's the sign language that the individual uses. Also, after every visit, we do a patient experience survey. And if you stay on and take the survey, you'll notice that the survey was actually designed. We actually employed a marketing firm that builds surveys for individuals with intellectual and developmental disabilities, mainly cognitive disabilities. It's one of the first of its kind to actually survey individuals that have cognitive issues, and it actually speaks the text. The text is there in bigger font. has the answers are in pictorial form, and they're also in word form. And it's a simple 7-question survey. So we get information from the individual so we can tailor our services for them in the future. We try to be as inclusive, and we try to figure out how to deal with all the different types of disabilities that are out there. And one of the neat part is, all of our clinicians are trained in working with individuals with intellectual and developmental disabilities. So we actually have a 20 a 20 module training course that we put all of our physicians in, and 4 of those modules actually are modules on how to communicate with individuals with intellectual and developmental disabilities, especially those that have a hard time expressing themselves with words. So, though it's not, I mean, nothing is perfect, but at least it's an introduction to this particular topic. So then, sometimes you have to slow down. Sometimes you have to give time for the individual to speak. But in the end, it's person-centered. So everybody's unique, everybody's different, and we try our best to try to accommodate that individual as much as possible.
So, kind of a follow up question. You talked about maybe having an interpreter on the session or on the appointment. Does that cost the individual? Like, how does that? Okay,
It costs
so
us, but we don't pass on the cost to the individual. No, 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 no,
okay,
not at all.
just. So, what is there a cost? You know.
Yeah, so that's a good question, Candace. So there is a cost, but in the state of Missouri, if you're on a waiver, Medicaid waiver, the cost is covered by the Medicaid waiver. So the cost actually gives you access to the program. Because we're available 24 hours a day, 7 days a week, via technology, there's obviously a cost to that, to maintain it, to make sure that there's some staff available. In addition to that, we also have staff that guide the individual through the visit. So you may have a hard time with technology. I mean, you certainly don't have a hard time with technology, but some individuals may have a hard time, right? They're not sure what to do. So for us, all you need to do is pick up a telephone, a regular wired telephone, and dial a number, a 1-800 number, and then you get in touch with our navigator. And our navigator will get your information, and they'll say, what device are you using? Is it an iPad? Is it a cell phone? And they will walk you through the steps. Many of the folks that we support sometimes forget, right? So they may know how to do something right now, but then next week they'll forget. So we understand that. So the navigator is there to help those folks that have those cognitive issues to connect to the doctor. And then they get to the last step, press a button, and now the doctor's on the screen. Do you see the doctor? Yes, I see the doctor. Great. So all of these things, my point is, there's a lot here. It's a program. So the waiver dollars help support and pay for that program, access to the program. And then when you see the doctor, like you would any other doctor, and the doctor has their bill, we send that bill to the individual's insurance company. And if it's Medicaid, it's Medicaid. If it's Medicare, it's Medicare. If it's private insurance, private insurance. So basically, there's out of pocket, there's essentially no cost to the individual because the access fee is picked up by the state through the waiver program, and the actual physician service is billed to the insurance company. And most of the time, it's Medicare and Medicaid.
Oh, that's cool. So I have a follow up question. Um, I know. Well, there might be a wait list for for services, but if a person doesn't have that waiver or whatever, waiver or support coordinator, could they still contact you through their through their in private insurance?
That's a really good question, Candace, and we get that often. Unfortunately, right now we're solely through the Medicaid waiver program in Missouri, but we are looking at ways to expand that service. There's unfortunately some regulations and rules. If you participate with Medicaid, it's hard to charge the individual who's willing to pay for the service because we take Medicaid. So there's a bunch of other rules out there, but we're navigating all of those rules because our goal is to make sure anybody who has an intellectual developmental disability has access to our service. We know we can reach a lot of people through the Medicaid waiver program, but we also know that there's a lot of people outside that are either on a wait list or just don't qualify but could use our service. So we're looking at different ways to try to reach those folks.
Okay. So maybe in a couple years you will have
I
a
hope so.
yes,
Fingers crossed. Fingers
finger
crossed.
crossed. So uh, and then you can come back and talk about that. Yeah.
I would love to. I
Hey.
would love to.
Yeah.
Yeah.
So I have another question. What about someone who might have dual diagnosis? So they might have autism and depression, or do you guys have can they come to Station MD?
Of course they could. Of course they could. Because somebody with a dual diagnosis may have a physical complaint at the time, or they may actually have a mental health complaint at the time. So we'll be able to take care of both of those complaints. But you should also understand what we're not, right? We're not psychiatrists. So we wouldn't start the individual or change the medicine that they're on for that individual, but we can help guide them through the next steps. Sometimes individuals with intellectual and developmental disabilities have a hard time expressing pain with words. So they may have an aggressive behavior or they may show signs of agitation, but our docs are actually trained to kind of see if that agitation is because of, hey, a toothache or maybe a headache or maybe menstrual cramps, something physical that's causing some sort of behavior that the general population is like, oh, this person must have acute psychosis, but they're not acutely psychotic. They're just trying to explain that my tooth hurts, right? So they're banging their hand with on their face because they're just trying to show you my tooth hurts, right? So our docs are attuned to that, so they can try to pick that up. So we encourage, if you have a dual diagnosis, of course you should call. As long as you have an IDD diagnosis, that's the only requirement. Then yes, then you can use our
Yeah.
service.
So and one more question. How does Station MD help a person become more independent?
Yeah, so StationMD, that's a really good question because the individuals that we support, right, the ones that are patients, once they use StationMD one time, they tell their caregiver, please call StationMD or please help me connect to StationMD. And many of the folks will just pick up the phone themselves and call when they feel something is wrong. That empowerment, right? You may have a physical disability that you rely on somebody to take you to the doctor. But if you can just pick up the phone and make that move, that empowerment, that sense of independence, I mean that you're taking ownership of your own health. That is huge. That's huge. And we see people do that all the time. We have some folks that call us every 2 or 3 days. Something's up, and it could be something really tiny and minor. But we understand, and I know what it is. It's like they feel empowered. They feel like I can control one. There are a few things that some folks that are really dependent on others to help for their day-to-day activities, there are a few things that they can control. And if we're one of them, if healthcare is one of them, that's a huge step
Yeah,
in the right
yeah,
direction, right?
yes, yes. That's very important. That's very impactful to have someone who might need help getting out of bed be able to call and say, "Hey, something's wrong. Can I talk to her?"
Yes.
So and that gives them that sense of empowering and belonging, and not feeling maybe. And I don't want to put words in people's mouth, but not feeling like they're being a burden on somebody else, because they can call the doctor and say,
Right.
"Hey,
And they don't have to rely on an institution. Rely on like the hospital or, a clinic to I mean, if you need it, that's where you have to go. But there are options. There are options for everybody. So telehealth is an option for everybody in the United States. They can call, well, they pull out their insurance card, there's some telehealth option for them. But people with intellectual and developmental disabilities don't have a specific resource in the telehealth world for them. And we feel that we're that resource and we're kind of leveling that playing field. I feel like that there's something missing on the different tools that individuals with intellectual and developmental disabilities have to support their health. And that's telehealth, and we fill that gap, I think. So we kind of level that playing field, so it allows that individual more independence.
Yeah, that's awesome. Well, I appreciate you taking time out of your day, Dr. Devin. Do you have anything else to add before we wrap up?
No, I mean, well, Candace, thank you so much for having me. This was really fun, and I always love to talk about what we do. So thanks for stopping me from going on and on and on because I can do that. Um, but no, I just want everybody in Missouri that either supports somebody with intellectual and developmental disabilities, or if they are somebody that has an intellectual and developmental disability that's on the waiver program, I just want them to know that we are available for them, that they should reach out to their supports coordinator so they can link up to our services, so that we're there as a backbone, as a support anytime they need us, to help care for those care for them, and they can live a more independent and healthy, um, and successful life.
Yes, yes. And I need to. I'm thinking I need to talk to my mom about doing
Yeah.
too. You know. But yes, I appreciate you and everything that you and StationMD are working on to help people with IDD have a more independent life or more independent with their doctor. But so I appreciate that. And so, to summarize what we talked about today, Dr. Devin told us information about Station MD, um, and how Station MD can help an individual be more independent within their health and healthcare. So I really, and a lot of other things, but I really appreciate you, Dr. Devin, and I look forward to hopefully interviewing you again for the next year once you get that more money, more opportunities. So
That's
yes,
right. That's right. Be happy to come on, Candace, and happy to come on and talk about any other topic that you think I
yeah.
could be relevant with.
Thank you, thank you. I hope you have a great day, and thank you again to everyone watching Candace's Corner.
Thank you.